What's up, y'all? Welcome to StudyRite. I'm your girl, Janisha Mickens Ingram, and I will be your facilitator for this presentation. As you know, we always discuss the clinical loop of therapy. Today, we're going to focus on the lens of diagnosing. Today's presentation is going to be specifically on personality disorders. With that, we want to understand that there are multiple levels of personality disorders, which is cluster A, B, and C. But today, we're going to focus on cluster A and B. For the exam, we're going to make sure that we're specifically giving you key components to cluster A in order for you to better understand what the vignette is asking and to narrow down your answers. As we all know, we must meet criteria for us to diagnose the client with any diagnosis in the DSM. And what that looks like is the client is going to present symptoms and you're going to observe symptoms and create the diagnosis. However, it must affect their everyday life. Cluster A. In this cluster, it's considered the odd eccentric cluster. It includes paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. The common features of the personality disorders in cluster A are because they're social awkwardness and they display social withdrawal. These disorders are dominated by distorted thinking. All right, gang, here we go. Cluster A, paranoid personality type. What are we looking for? What are the signs and symptoms presented in this exam? Some of them will be the individual has a pervasive distrust and suspiciousness of other people. People with the disorder also assume that others are out to harm them or want to take advantage of them and also humiliate them in some sort of way. They put a lot of effort into protecting themselves and keeping their distance from others. They are known to premeditatively attack others who they feel threatened by. They also tend to hold grudges and display pathological jealousy. So they have a lot of distorted thinking in the event, and they kind of stay on the past events. They want to just stay there. They don't think anything differently. They display odd behavior, and their emotional life tends to be dominated by distrust and hostility. Now we're going to move right along to schizoid personality disorder. This is a disorder where individuals have an uncommon condition that causes people to avoid social activities and have trouble displaying emotions. So people who have flat affect or no affect at all, no emotions, no laughter, they're just blanket. Dry eye, clear eye type of guy. To other people with schizoid personality disorder may seem humorless or cold. Other traits of schizoid personality disorder include the following: preferring to be alone, not wanting to enjoy close friendships, feeling unable to experience pleasure from anything, having difficulty expressing emotions, having difficulty reacting appropriately to emotional situations, feeling little or no desire for sexual relationships. Last but not least, we're going to move on to schizotypal personality disorder. Schizotypal personality disorders, these individuals are often described as having unusual personalities. They tend to have few intimate relationships, distrust in others, and experience a great deal of social anxiety. Other traits of schizotypal personality includes the following: using a peculiar style of speech or unusual speaking patterns, lacking close friends, dressing in unusual ways, such for instance, if it is hot outside, there are layers and layers of clothes, maybe a little weird dressing, different attributes to their attire, believing they have unusual powers such as the ability to influence events with their thoughts. Oh, I'm going to make the world move, or all the people are going to gravitate towards me once I close my eyes. Experiencing unusual sensations such as hearing a voice that isn't there, things that other people can't naturally hear, having unusual beliefs, behaviors, and mannerisms, being suspicious of others without reason, having inappropriate reactions. These are all signs and symptoms of individuals with schizotypal personality disorder. If you enjoyed this presentation, please like, subscribe, and comment below. If you would like more information on StudyRite, please follow us on Facebook at LMFT StudyRite. If you study right, you won't study wrong.